Training bloodborne pathogens. Bloodborne pathogens, 29 CFR 1910.1030. This OSHA standard prescribes safeguards to protect workers against the health hazards from exposure to blood and other potentially infectious materials, and to reduce their risk from this exposure. Over the years, there have been outbreaks of diseases around the world. 3 examples of outbreaks that have affected the U.S. include the 1981 outbreak of HIV, the 2014 outbreak of Ebola, and, most recently, the 2016 outbreak of the Zika virus. All 3 are examples of diseases that can spread through contact with infected blood or other bodily fluid. What are bloodborne pathogens? Disease-causing microorganisms in blood, bodily fluids and tissues that can cause serious diseases in humans. Example health hazards include but are not limited to hepatitis B, hepatitis C, HIV, malaria, brucellosis, syphilis, West Nile virus, etc. Bloodborne pathogens of primary concern. Hepatitis B. Over 12 million Americans are infected, 1 in 20. Silent infection. Symptoms include jaundice, fatigue, abdominal pain, loss of appetite, intermittent nausea, vomiting, may lead to chronic liver disease, liver cancer, and death. HBV can survive for at least 1 week in dried blood. Up to 40,000 people in U.S. will become newly infected each year. Bloodborne pathogens of primary concern. Hepatitis C. Hepatitis C is the most common chronic bloodborne infection in the U.S. Symptoms include jaundice, fatigue, abdominal pain, loss of appetite, intermittent nausea, vomiting. May lead to chronic liver disease and death. Bloodborne pathogens of primary concern. Human immunodeficiency virus, HIV. HIV is the virus that leads to AIDS. HIV affects the body's immune system. HIV does not survive well outside the body. Estimated more than 1.1 million people living with HIV. Infected for life. Means of transmission or common routes of entry. Sexual contact with an infected partner. Sharing infected needles. Accidentally cutting yourself with a sharp object that is contaminated. Infected blood or body fluid on skin with open cuts, sores. Getting contaminated blood or body fluid in eyes, mouth. Risk exposure. Occupational exposures. First responders. Housekeeping personnel in some industries. Nurses and other healthcare personnel. CDC estimates that 5.6 million workers in healthcare and related occupations are at a risk. Exposure Control Plan, ECP. Written Plan. Review and Update Plan. Exposure Determination. Schedule and Method of Implementation. Procedure for evaluation of exposure incidents. Accessible to employees. Review and update annually when new or modified tasks, procedures are implemented. Controlling exposure. Observe standard precautions, such as treating all blood and bodily fluids, spinal fluid, vaginal secretions/semen, as if they are contaminated. Proper cleanup and decontamination. Engineering and work practice controls. Safer medical devices. Sharps disposal containers. Hand hygiene. PPE examples. Gloves. Masks. Aprons, smocks, gowns. Face shields. Mouthpieces. Safety glasses. CPR pocket masks. Universal precautions: treat all blood and body fluids as potentially infectious. Skin protects from pathogens. Cuts, dermatitis, chapping, small cracks allow germs to enter the body. First aid: use gloves, have as little contact as possible with blood or body fluids. Wash hands with antibacterial soap after contact. After contact, flush eyes and face with fresh water for several minutes. Cleanup and decontamination. Wear protective gloves. Use appropriate disinfectant. Clean and disinfect contaminated equipment and work surfaces. Thoroughly wash up immediately after exposure. Properly dispose of contaminated PPE, towels, rags, etc. Regulated waste disposal. Dispose of regulated waste and contaminated sharps in closable, leak-proof red or biohazard labeled bags or containers. Laundry. Contaminated laundry must be bagged or containerized at the location where it was used. What to do in case of exposure. Exposure incident. Specific eye, mouth, or other mucous membrane, non-intact skin, parenteral contact with blood or other potentially infectious materials, OPIM, that results from the performance of an employee's duties. Immediate actions. Wash exposed area with soap and water. Flush splashes to nose, mouth, or skin with water. Irrigate eyes with water and saline. Report exposure immediately. Direct employee to healthcare professional for treatment. Confidential medical evaluation and follow-up. Routes of exposure and circumstances. Source: individual. Collect/test blood for HPV and HIV serological status. Post-exposure prophylaxis, when medically indicated. Counseling. Evaluation.